Thanks very much, Mark. So I want to talk to you about the sort of the baseline, the current situation with immigrants, both legal and illegal, in terms of how much they cost the Medicaid program. I would say this is also relevant not just to the Democratic presidential candidates, but also to the presidential proclamation that happened, was it last Friday, right? The proclamation that said that immigrants applying under certain visas will have to show that they have health insurance before they're allowed to enter. And of course, the reaction to this was, as you might expect from certain quarters. I have to say, sort of as an aside, I do find the media's reaction to this whole issue kind of humorous. Before the Trump administration, groups like the Center for Immigration Studies would put out reports that say, you know, we tabulated some census data and we found that immigrants do in fact use means-tested anti-poverty programs, and in some cases they use them at higher rates than natives. And the response from a lot of people in the media was to say, that's absurd. Immigrants don't use welfare. In fact, apparently you guys have never even heard of something called the public charge rule. And the public charge rule says that you can't be here if you're as an immigrant if you are on welfare. Well, as soon as the Trump administration became serious about enforcing the public charge rule, suddenly, overnight, the talking point changed considerably. And in fact, this was criticized because it was too draconian. It would affect 2/3 or 3/4 of all immigrants. It's difficult for me to keep all the talking points straight. But we don't give you talking points here. We're going to give you just the facts here. So certainly immigrants do use Medicaid. There are some restrictions, of course. Not all immigrants are eligible. In fact, generally speaking, if you're an immigrant who wants to use Medicaid, you have to be a legal permanent resident. That means not a temporary immigrant like someone on a student visa. And you also have to have lived here for 5 years, generally speaking. But there are, of course, exceptions to those rules, as there always are. Humanitarian immigrants, for example, refugees, asylees, they can access medical care immediately. Generally speaking, children and pregnant women also do not have to wait the 5 years to get coverage. And emergency services are available for everyone, regardless of whether you're legal, illegal, or anything else. And another exception, if you want to call it that, is that U.S.-born children of immigrants are fully eligible for Medicaid and every other program that citizens are eligible for. And we'll get into why that matters in a second. So let's dive into some results here. I won't belabor the methodology. We can bring that up in the Q&A if you like. This is from the Medical Expenditure Panel Survey, and this is just enrollment rates that we're looking at right now. And I'd like you to focus on the individual row at first. You can see that despite the legal restrictions on which immigrants are allowed to use Medicaid, overall immigrants still use Medicaid on an individual level about the same rate as natives, at 23%. And you can also see that I've divided immigrant into some interesting subcategories, and there are less skilled immigrants tend to be on Medicaid more often, which is not too surprising. I would argue, though, that the family row is the more important row in this analysis because immigrants are not individuals in the sense that they have dependents just like anyone else would have dependents when they are living in the United States. And in particular, they have U.S.-born children, as I mentioned, who are eligible for Medicaid. Now, there's a debate about this. Some people would say U.S.-born children of immigrants should count in the native column. Others say it should count in the immigrant column. I am very much of the view that it should be in the immigrant column. And the reason is this. Parents have a legal obligation to provide basic services to their children. They have to provide them food, they have to provide them shelter, and they have to provide them medical care. So if the government steps in and says, we're going to do that for you, that's a benefit not just to the child, but to the parent. So you have a lot of cases where immigrants will be in the country and not on Medicaid themselves, but their children will be put on Medicaid. And you can see from the table there that once you look at on a family basis, immigrant families are significantly more likely to use Medicaid compared to natives. And in fact, the lesser skilled immigrants, you have a majority who are actually on Medicaid. I should say at least one member of their family is on Medicaid. Now, in terms of costs, that's the next column here, or next table, you might be thinking, gee, how do we know cost? Do we really go around and ask people, excuse me, how much did you cost the Medicaid system last year? No, so there's a separate provider survey within this data set where they actually ask the doctors and the hospitals, how much was billed. So it's a generally more accurate estimate than you might expect from first glance. And unsurprisingly, you see that immigrant families do cost more than native families. This is for everyone. This is like a per capita or per family estimate. So it includes people not on Medicaid, in which case, obviously, their costs are zero. And you can see again that lower skilled groups like people without a college degree tend to cost more. Now, when I give this kind of presentation, I sometimes get the reaction, or sometimes people accuse me of having the reaction, of stating that immigrants are lazy. Immigrants are moochers. Immigrants are just coming here to live off the U.S. taxpayer. No. That's not the case. I don't see that in the data. I don't see any special appetite for welfare among immigrants. What I do see is that immigrants have certain demographic characteristics that, when found among natives, also leads natives to be more likely to go on Medicaid. And I'm speaking specifically of two things: lower levels of education and larger families. Whether you're born in Honduras or Washington, D.C., if you live in the United States and you have a low level of education and you have a lot of mouths to feed, you are likely to be on Medicaid. It's not a special problem with immigrants. It's just the fact these are the characteristics that they have. In fact, I have a little numerical example to show you of that, just a real basic regression analysis. If you look at the cost difference column here, that's the difference in cost between the average immigrant family on Medicaid and the average Medicaid cost for native families. And that first row is no controls. So that $813 cost difference is the same one we saw in the previous table. But now if we start to control for family size, for example, the number of adults in the family, you see the cost difference go down to $639. And then if you add in a control for children, it goes down to $423. And finally, probably most importantly, you control for the education of the head of the family. And then once you do that, the difference is a very negligible $25. So you can see that we can account for virtually all of the cost difference simply by looking at the education level of the immigrant and also the family size. The lesson here in terms of immigration policy should be fairly clear. It's that if we want to reduce immigrant dependency on Medicaid, including their children's dependency on it, then we want to change the selection criteria such that we have more skilled immigrants, such that immigrants come in with the kinds of earning power that we know they're going to be able to support not only themselves, but also any children or other dependents they might have when they're in the United States. I think certainly the proclamation I mentioned earlier about requiring health insurance for certain immigrants is a step in the right direction. How meaningful it will be remains to be seen in terms of the exact details of the plan. But as I said, a step in the right direction. A step in the wrong direction would be to expand the eligibility pool among immigrants, especially if you're expanding it to include even illegal immigrants. And that would be a very costly program. And to give us the cost of that, we have Dr. Camerata.